Over 65, beware. How dangerous is the new COVID-19 variant in 2025? In 2025, the world once again finds itself facing a new chapter in the ongoing COVID-19 saga. While vaccines and public health measures have made significant progress, the emergence of new COVID-19 variants has reignited concerns, especially among vulnerable populations. Among those most at risk are adults over 65 and individuals with pre-existing health conditions. In this video, we explore the implications of the 2025 COVID-19 variants. With a special focus on the elderly population, we examine the science behind the mutations, the symptoms to watch for, the latest vaccine updates, and practical steps for protection. The pandemic may no longer dominate headlines as it did in 2020 or 2021, but it hasn't disappeared. In 2025, new variants such as NB.1.8.1 and LP.8.1 have emerged and spread globally. These variants are raising alarms among virologists and healthcare professionals due to their potential for increased transmissibility, immune escape, and severity. In early 2025, the Centers for Disease Control and Prevention (CDC) confirmed that NB.1.8.1 had been detected in California, Ohio, and New York. Simultaneously, LP.8.1, a descendant of the JN.1 lineage, became the dominant strain in the U.S., accounting for nearly 70% of new cases by March. Experts are especially concerned about the increased reinfection rates and the number of hospitalizations among seniors, despite previous vaccinations and infections. Why seniors are at higher risk? Aging comes with physiological changes that impact the immune system. The elderly are more likely to experience weakened immune response. The body's ability to detect and respond to pathogens diminishes. Higher rates of chronic illness. Seniors often deal with hypertension, diabetes, heart disease, and kidney problems, all of which can exacerbate COVID-19. Increased risk of complications. Elderly patients are more prone to pneumonia, respiratory failure, and systemic inflammation due to COVID-19. CDC data reveals that individuals over 65 continue to represent a disproportionate percentage of COVID-19 deaths and ICU admissions. Understanding the 2025 variants. NB.1.8.1 originated in China. Rapid spread in western U.S. states. High hospitalization rates in seniors. LP.8.1 subvariant of JN.1 accounts for most infections in 2025, demonstrates strong immune escape. Both variants carry spike protein mutations that help them evade neutralizing antibodies, even in vaccinated or previously infected individuals. These mutations have made them more capable of spreading, especially in crowded or indoor settings. Symptoms and how they differ in 2025. While classic COVID-19 symptoms persist, the new variants present some differences: sore throat, fatigue, dry cough, mild fever, body aches, congestion, headaches, nausea. In elderly individuals, symptoms may present more subtly or atypically, such as confusion or delirium. Sudden fatigue without fever, reduced appetite. The risk of reinfection. One of the defining features of the 2025 variants is their ability to reinfect individuals, regardless of past infection or vaccination. Seniors, particularly those in nursing homes or long-term care facilities, have reported multiple infections within a year. Reinfections may lead to longer recovery times and higher risks of complications. Long COVID in the elderly. Long COVID refers to lingering symptoms that last weeks or months after the acute infection. Common symptoms include chronic fatigue, brain fog, shortness of breath, anxiety, and depression. These symptoms can severely affect quality of life, particularly in seniors who may already be managing other chronic conditions. The good news is that new vaccines have been developed to specifically target the NB.1.8.1 and LP.8.1 variants. As of April 2025, the FDA has authorized updated mRNA booster shots. Vaccine highlights manufacturers Pfizer, Moderna, and Novavax. Targets NB.1.8.1, LP.8.1, and earlier Omicron strains. Recommendations: booster shots every 6 months for individuals over 65. Efficacy: preliminary data suggests a 70 to 80% reduction in severe disease in vaccinated seniors. Vaccination remains the best way to prevent COVID. Vaccination against COVID continues to be one of the most effective ways to prevent COVID and protect against it. Experts strongly recommend that older adults and individuals with chronic health issues receive the updated vaccine as soon as it's available. Preventive measures for seniors. Even with vaccines, precautions are essential. Steps to protect yourself or your loved ones include wearing high-quality masks in crowded or poorly ventilated areas, avoiding large gatherings, practicing good hand hygiene, ensuring indoor spaces are well ventilated, maintaining a healthy lifestyle to support immunity. Nutrition and immune support. A well-balanced diet is essential to boosting immunity, especially for seniors. Recommended foods: fruits and vegetables, rich in vitamins C and A. Protein: lean meats, beans, and tofu to maintain muscle and repair tissue. Whole grains: brown rice, oats for energy and fiber. Healthy fats: olive oil, nuts, and fatty fish. Probiotics: yogurt, kefir to improve gut health.
Hydration: drinking water and herbal teas to stay hydrated. Supplements such as vitamin D, zinc, and omega-3 south may be beneficial but should be taken under medical supervision.
The psychological impact of the ongoing pandemic cannot be underestimated. Loneliness, anxiety, and depression have increased among seniors due to isolation and health fears.
Tips for well-being: stay connected with loved ones via phone or video calls. Engage in light physical activities.
Join online support or wellness groups. Practice mindfulness and breathing exercises. The threat of COVID-19 in 2025, particularly from the NB.1.8.1 and LP.8.1 variants, is real and pressing, especially for seniors and those with chronic health conditions. But with the right knowledge, updated vaccines, and a proactive approach to health, the elderly can remain safe and resilient. It's never been more important to stay informed. Share this knowledge with your loved ones. Protect those who are most vulnerable. Thank you for reading. If you found this information helpful, don't forget to like, share, subscribe to our YouTube channel Healthy24H for more expert health insights. Stay healthy, stay safe, and thank you for supporting our mission to keep America's seniors informed and protected.